doctors, social workers, and go on and on in terms of all these professional schools.
Yes.
And if I make that link to when we're talking about us being seen as criminals and sinners and immoral, part of our history, sadly, is that we were also seen as sick by a lot of people. There's a long history of that. And to this day, battles continue with psychiatry in that area, and the DSM, the Diagnostic Statistical Manual, for mental disorders. And so all of that, I mean, one of the things that QueerOntario has begun looking at is whether there's any way that the provincial government can have any kind of impact guidelines-wise for curriculum in the training of these professionals. So medical schools, nursing schools, schools of social work, all those kind of specialty professional training, if there can be a set of guidelines to assist them. Because obviously on the ground, what you're describing is that these are professionals who are on the front lines, working with our communities, and are quite unprepared.
Unprepared, absolutely. I think it's actually probably one of the next most important things to do. We have made some efforts to go out and talk directly to the professional schools, so to go to the schools of medicine, social work, psychology, nursing, etc. And what we typically hear back is, there's so much in the curriculum, we'd have to take something out to put something in. And we say, not necessarily. I mean, sometimes you just have to alter the, instead of always making it the 50-year-old white man who's straight, change up the case scenario. But I would say not a lot of ground is being made. We get invited, and other people, probably some of you get invited in to do your guest lecture here and there, or to do the special day or something. But we're always kind of like the add-on bit. And there's a recent journal of the American, what's JAMA? Medical Association.
Medical Association.
Yes. Showing that physicians are averaging less than 5 hours across in North America in training on anything LGBT. So it's not surprising. To your question, what could we do? I actually think this is something that we do need to work on, and maybe this is something we could work on together. And I don't exactly know where the pressure should be. There are accreditation standards, and it seems as though the accreditation standards for professional schools do require a certain level of diversity type education, and within that some focus on sexual orientation and gender identity, just as they probably would on issues of race and culture and so on that might affect people's health as well. But I don't think that's going to be enough, and maybe we need to talk to, well, Glenn Murray was until recently the Minister of Training in
colleges and universities.
Right.
And that's, in fact...
So that might be a good person to talk to if he...
We had some beginning dialogue with him. Now, of course, we know what's happening with the government, and now he's left that post in order to run for leader. And so, nevertheless, it's
Did you get anywhere with him?
Yes, we did.
Yes?
We are.
What did he say?
He's very, very receptive to opening talks and increasing the knowledge across the learning bases in Ontario, Teachers Association, and so we are working on trying to get meetings set up to further that, and it's mandated that we're going to do that, so I see it happening.
Well, good.
And definitely even further with doctors and others, we talk to others.
I think it might end up being one of those things where you have to hit everybody, and it might be something that several of us, RHN, QueerOntario, Rainbow Health Ontario, and others could do together, because we probably need to talk to the OMA, the College of Physicians and Surgeons, the College of Nurses, RNAO, on and on, and the government bodies, and the schools, and so on, so that everybody is kind of getting the same message. But this seems to be one of the toughest nuts to crack. Training on health or social services about LGBT people into the curricula, and the core curricula of our schools, because our professionals are coming out very, very uneducated in this way, uncomfortable very often in working with us, and making mistakes or learning on our backs, basically. You know, learning by asking us for the information that they should be learning in the first place. So I think it's deplorable.
And something that we certainly can work on, I mean, this stemmed, when David was talking about in terms of teachers and education, it stemmed out of the whole controversy around the GSAs.
Yeah.
And so there was talk that teachers, another profession, and teachers' colleges were not preparing them to work with students who identified as queer. So, and then when that started to roll forward, I started to push saying, well, if we're talking about teachers, we can also be talking about a series of other professionals as well. So, so we'll see where we take that, and we want to follow
Maybe
up
we
with each
should
other.
talk some more about it.
Right.
Do people think that that might be an idea for several of us to band together around this kind of stuff? Yeah.
It sounds like we need to present some solutions as well, like the case study
Yes.
example, to say you have no excuses.
Exactly. And the other thing I think we should do is actually present, prepare a kind of brief showing what some of the health issues and health disparities are. Because I think often people think that all it is about being nice. And maybe HIV and a few sexual health things. And I'm not saying that HIV is not important, of course it is. But sometimes everything gets reduced to one thing. And I think we need to talk also about the issues that are facing trans people in getting care, because that's a huge issue still. The issues for people to get appropriate, respectful mental health services. We have higher smoking rates, we have higher rates of certain kinds of substance use, we have a number of issues that need to be spelled out, plus the reasons why those are. Because I think ultimately to speak to the government, you have to say, in the end this is, first of all, what you should be doing. You're mandated to serve everybody. There's the Excellent Care for All Act, and we can use that. You're supposed to be providing quality, and it's costing us more to have people who are not being served properly.
I think those are all great ideas, and they have been implemented. Because if you go to medical school, if you go to teacher school, there's anti-oppression education, which includes LGBT sections. Here's the difference: it's not mandatory courses, they're electives. And I think that's where the problem is. Like, if you're coming from a heterosexual, sort of middle-class kind of geopolitical identity, socio-political identity, you're not wanting to choose these courses because they don't relate to you. And I think that's where the disconnect is, because you can have all that, but if it's not mandatory, who's actually going to take these courses? Guess who's going to take these courses? By the individual.
Yeah. No, I quite agree. I think we're talking core curriculum, not elective, not the guest lecture, not the lunch and learn. We do all that because right now we don't really have a choice. It's that or nothing. But it's very frustrating.
And there are models out there that are being looked at so that even specialized courses that may exist that are LGBT focused, like you said, those are almost definitely electives. There's more of an integrationist model that's being pushed now in education that comes back to what you were saying, so that it's not a matter of taking something out to put something in, but it's reshaping what you currently have and diversifying it and making sure you have LGBT content therein in your core courses so that all students are exposed to it.
Just as you would with racialized people or issues of disability or anything. Like we'd have to talk about all these things, right? Not just the one. Yeah.
Maybe as the society as a whole gets better at the pronoun thing and the gay is okay thing, maybe we won't have to put that in the curriculum. We can move on to the actual medical issues and other health issues. That might compress the curriculum, and it's going to take a little while, but we're making some progress in society.
It's also fighting the heterosexism that is, like you're saying, having case managers look like it's a husband and wife having sex or like that kind of thing, where they're just like, I had a lesbian before in my case. It's not taking away from it, it's just adding but being more LGBT positive.
And do you think that the rift between psychiatry and medical profession from a healthcare stance causes a lot of issues, especially with the stranglehold CAMH has on mental health and the LGBTQ?
Well, I guess I see quite a few shining examples now of psychiatrists that are definitely, coming from the right place, and other physicians who are coming from the right place. So I do think that, and some of them are queer people. They're often queer people themselves, so they're not outside the community. So I think it is. There are people who have influence from within those professions, and those are really important. CAMH is still the place where you have to go in the end to get your assessment for surgery, but you don't have to go for anything else. And now that we're doing much more training and helping people in the professions, the health professions, to understand that we can work with trans people within primary healthcare models. They don't have to be sent necessarily to specialists. If they need a specialist for something, that's different. But routinely, they don't. And so one of the projects that we did over the last 2 years was going to do intensive training with health centers who then invited in people from their regions on trans health. And believe it or not, we started by trying to go as far as we could from Toronto to try to fill in some gaps. We had 70 people in Thunder Bay coming to learn for 4 days of training spread over some weeks about trans care. And that kind of number in Ottawa, and that kind of number in Windsor. So there really has been, a real change in the uptake. So now those communities, having taken a lot of training, are starting to organize on their own, to bring people along, to get more people involved. In Ottawa, they're organizing their own little network, regional network, where they can have their own mentorship sessions and so on. So bit by bit, places outside Toronto are coming along.
Yeah.
Susan, you had your.
I was back at lobbying the Liberal leadership candidates, but sure. So now I want to ask, I had multiple assessor sites, but I don't know, I missed the beginning, so I don't know so at the last QueerOntario meeting we had talked about, the Liberal leadership, and so has there any thought about, I think this is one of the questions around the curriculum that would go into a questionnaire to the leadership candidates. So has there been any follow-up or thought on that? Because the time is now to sort of try to gauge the leadership candidates' point of view and put that in the public discussion, publish that in the report card on your website, and sort of just keep pushing on that, keep pushing that elephant up the mountain. And then you develop relationships with whoever the eventual winner is. And whatever happens is that January 25th, they select right around, just a 5 minutes walk from here. There may be people protesting and there may be not. But then whatever happens, on January 26th or the day after the leadership, we're still in a minority government, so you can put pressure on with the other parties too to push forward that agenda. So I'm thinking out loud.
Yeah.